Okay, good morning. So good morning, everyone. So in the continuation of the research topics related to research in palliative medicine, today we will listen to Arun. So we all know Arun very well, but the people, those who are new, just for them, that Arun, Dr. Arun and Dr. Anuja, with Dr. Anuja, they are the first palliative medicine MDs from this country, long time back now. Right now, Arun is clinical fellow in palliative medicine at University of Toronto. And Arun is working very hard to write good publication from India. And he's assisting, supporting and helping in various multicentric projects which were happening or which had happened in the country. And his area of interest is palliative care, mainly in cancer patients. And he has got a number of publications in peer-reviewed journals. So Arun, go ahead. And today Arun will teach us how to write protocol, because the protocol writing is very, very important exercise. As soon as we enter in any of the MD's course, we find it so difficult. Somebody says that you have to write protocol, but if you have not learned how to write properly, it becomes a huge challenging exercise. So Arun will teach you and make you a simpler way how to write protocol. Arun, go ahead, please.
Thank you, ma'am, for the kind introduction. So I'm sharing my screen now, and here we go. So most of the time I will talk during the presentation, and I cannot monitor the chat from here. So if you have any questions, we'll take it up at the end of the presentation. So the objectives of today's session are to understand what is research. I won't spend much time on that because I think that has been covered before, but we'll talk more about the components of a research protocol. We'll explain the role of each part, the component within the overall process of the protocol development. We'll try to understand the importance of the research protocol, why to write a protocol before doing a research. And hopefully at the end of the presentation, we'll get a basic idea about how to write a research. So just one or two slides about research. We all know that a research is basically a systematic way of doing investigation, where we collect some data to solve a problem, and sometimes also to contribute the knowledge about some kind of theory or practice which is there in the system, but we didn't have evidence for that. So basically gathering evidence for an idea to make it more credible is research. We have to follow ethical methods for that, and we generally put our research proposal through the ethical committees before we start doing the research. And most of the time, the research is independently verified, even after you do it. Like when you want to publish it, it's called peer review. So that is kind of independent verification of the research. So all these things are very important to get a good amount of data, good quality of data through ethical means. So, so we have to ask ourselves the question. Basically, all research starts with an idea or a question. So what is the big question here? Why are we doing research, or what do you want to ask yourself if you want to do a research? Take, for example, your thesis topic for the MD students who are here. You will have to do a thesis. So what is the question you want to ask me? So basically, research, as you know, is an integrated approach of deduction and induction. There is something we'll deduce, and there is something that have to be inducted. So hypothesis generation would be a deduction. Basically, take very simple example. Say analgesics will be able to control pain. So say paracetamol will be able to control most of the types of pain. So that is the hypothesis. And you have to test this hypothesis in a sample of population through your research. Why a sample? Because you know that you cannot test your medication over the whole universe, because you only have that amount of capability and that amount of patient to test your hypothesis. So based on that, you will deduce some induction, and you'll try to generalize the results. The more better or accurate your research will be, it will be more easier for you to generalize the results, or the results will be more valid in other ways. So it's very important to write a good protocol so that you know what are you going to do in your research. So that's why it is important to do that kind of exercise, also known as writing the protocol. So a little bit about, there are many kinds of research. So when you choose a research topic, you can, even in palliative medicine, you can do research on epidemiology, you can do research on behavioral sciences, socioeconomic conditions like health spending, and you have to apply statistical methods, you have to use biomedical knowledge for that, and everything is contributing to basically health systems research. And all the research that we do today will probably help to get better quality literature in palliative care, which will ultimately help in policy making, in planning, in management, in evaluation of a service, ultimately make the whole thing better for the betterment of our patients. So coming to the crux of the matter is protocol writing. It's not an easy thing. I mean, the picture speaks for itself. So again, when we talk about proposal, the key points are, again, I'll go back to the question. What is your question? You have to ask yourself the question. You have to ask your colleagues if the question is the right question. Also ask your teachers if this is the right question. Because most of the times, invariably, you'll see that somebody else has asked the question. And probably it is not the first time that you are asking the question. Why that is important is because it is important to understand the literature, do a good literature search before doing the research. So also you have to understand if the study is important, because otherwise there is no need to do the research probably. If you are trying to understand a very rare phenomena, which is probably not relevant to your patient, for your patients or to your study, then there is no point in doing the research. And also important how you're going to do it. You might want to do a randomized control trial, but you are just doing your MD, you have 100 other things to do. So probably you won't be able to do a randomized control trial. So maybe you will be able to do a simple observational study and not a randomized control trial, which you can do when you become a staff. So a few things before we try to sit down and write our research proposal. So coming to these things like choosing a topic. So the topic should be interesting, not only to you as an investigator, maybe it's something very close to your heart, but the topic should be interesting also to the funding agencies if you want to gather some funding for your research. Otherwise, how are you going to do research if you don't have funding? The topic should be interesting to the journal editors because you want to publish your research when the research is finally finished or done at the end of the research period. It should be useful to the consumers. Consumers here can be colleagues, public, like the patients, medical community, etc., the peer reviewers. The research should be relevant, like it should be able to add information to the scientific world. There's probably no point in duplicating research. You should try to do some research which is relevant to the population that we serve, for example, your patients. Should be simple and manageable in scope, like you should be able to complete the research within your short amount of time. For MD student, should be able to complete the research within 2 years. If you are probably a junior staff, should be able to complete within the short amount of time that you want to be able to manage your clinics and your research together. So you need money, time, manpower. So think about this when you write the research protocol. The results that come out of the research ideally should be able to alter clinical or health policy decisions in the future. There is no hard promise on that. We all aspire for that. So we can probably share it. Talking about the idea, your question, the idea should be feasible, doable at your institution, in your hospital, in your community, should be acceptable to your boss, to your institution, should conform with the ethics committee, and should be conceptually significant, adding to the literature in palliative medicine or palliative. So again, coming back to the question is the most important thing here. What are you trying to do in your research? What is the question that you are asking yourself? What is the research about? So sometimes the question that I kind of derive from is from personal experience, like my experience in seeing patients. I think that there is something that we don't know. For example, I'll just give a simple example. I have seen that patients take anti-epileptic medication, oral anticonvulsants for seizure, but there is no subcutaneous medication available for seizure control. We can't give phenytoin or Levera through subcutaneous route. So that's the thing I always think. What is the best subcutaneous medication for seizure? Is it phenobarbital? Is there anything else than phenobarbital? So that's kind of something I want to know from my personal experience. Sometimes you have to do a literature review. So probably with this research idea, I'll do literature review. What are the anti-epileptics that has been used in literature for a patient who is so sick that cannot use orally. You cannot do IV lines because the lines are all fired. You have to use subcutaneous route. So is the phenobarbital only medication apart from benzodiazepines that have been used for seizure control, or something else has been done? So I'll do a literature review, for example, in PubMed, in Scopus. Then I'll think about the theories. What are the best medications that can control the seizure? And I also ask my colleagues and my teachers to get more idea from them because they are 100 times more experienced than what I am. So with this, I'll probably try to understand my simple research question, because I think there is not much literature in this and there is something we can do about it. So what to have in a complete study protocol? This is like the first page of the study protocol, like the contents of the study protocol. So we need a title of the study protocol. For example, what I'm talking about here is we have to study the medication X, which will be used to treat seizures in palliative care patient only by subcutaneous route. Then we need a summary abstract of the research. This is the medication I'm going to test on this number of patients, and this is the results that probably I'm going to try to get, which will probably, the objective is to control seizure. How many patients can I get a proper seizure control? The next section is background literature review. I have searched PubMed, I've searched Scopus and other maybe great literature like the articles or abstract from conferences. This is the idea I have. Then I'll look into clinical trials. Has there been anything done before? Any kind of preliminary studies, if done on humans or animals, and also justification and rationale for using one medication over the other. The study objective and questions. So my study objective, I'm just giving an example here, to use a medication to control seizure in palliative care. The hypothesis here is my medication X will be able to control seizure in patients with palliative care, say for example, in 80% of the cases. My study design will be here an experimental study, probably a prospective study. And if possible, I'd like to do a randomized trial with a control and double blinded, if possible. That's kind of gold standard. But may not be possible. I can just do the same study using phenobarbital and see how many patients I can actually control the seizure using phenobarbital in a prospective way, just observational study. So it depends on your setting. Study population, in my hypothetical example, is palliative care patients, and which will be same for many of you. And methods of recruitment will be prospective and consecutive. We'll go through these things again, so I'm not going to talk much about that. Then comes the variable list and sample size. Variables are demographic parameters, clinical parameters, sample size. We'll talk a little bit about. So this is like the first page. What is there in my whole protocol? Gives an idea to the committee about it. So I have to also talk about other things, like how am I going to collect the data? Is it from chart records? Is it by interviewing patients? Is it by interviewing my colleagues? Is it from electronic medical data? What are the data collecting tools that I'm using? For example, sometimes we use a lot of questionnaires in palliative care. For example, once we use a cancer dyspnea scale, many of you must be using the ESAS, the Edmonton Symptom Assessment Scale of the tool. Just a few tools that you use in palliative care. In a protocol, you need to mention the plan of data analysis. I know that you cannot probably write about the analysis, but the way to do it, like this is the data, we'll do a simple mean median of the data to understand more about the number of patients, some frequency analysis. Sometimes we do correlation. Sometimes we can also do some kind of regression to understand if something is related to any of the independent or dependent factors. The timeline of research is important. So I'll recruit my patient within 6 months, then I'll probably finish my research in another 4 or 5 months. I'll write up in 3 months. I'll prepare the whole data in a good format in another 2 months, and I'll submit to the committee in probably a year's time. This is the timeline. You have to mention that in a research protocol. Also known as the Gantt chart. It's helpful for you also to keep track of time. Issues for ethical review approval. You have to fill ethical review form and submit it to the ethics committee for a good research protocol. Operational planning and budget if needed. Sometimes most of the research is investigator initiated, so not needed. Plan of dissemination, results reporting. So this is like I plan to disseminate the results in the way of writing a thesis, in the way of presenting in conferences, in the way of writing a paper. Why important is that sometimes if you think that you want to present in a conference, I'll probably put some money for presentation like travel, expenditure. You want to submit to a journal, sometimes you need APCs like article processing fees. So put some money in your budget just to publish and present the research. It's important because later on, no one is going to fund you. Definitely. So now the references. So references are important. You have to mention the reference in a scientific way. People do either Vancouver or Harvard way of referencing, and there are many reference softwares like Mendeley, which is free. And if you have subscription, you can also use EndNote, but Mendeley is good enough. So actually, that was all about the presentation. Like, what is their research protocol? I'm just going to go through the few things in a bit more detail, just for the better understanding of what I'm trying to say here. So again, the title should be catchy. It should be actually a selling point. If I look at the first page to the title of your research, I should gain some, I should be interested in your research. The title should not be like 5 lines. It should be like 1 or 2 lines. It should mention the population, the intervention, the comparator if you're using, and the outcomes. So in my hypothetical example, I use so that drug X is able to control seizure in palliative care patients in 80% of cases. An observational or experimental study. This is my title. And you have to think about it, revise it multiple times, talk to your teacher, talk to your colleagues to kind of refine it. So needless to say, it should be attractive, easy to understand, and should be concise and informative. Just don't describe the whole thing in the title. So the background. So this is the place where you need to study a lot about what has been done about your research. So if I want to use something in palliative care and seizure control, I'll do a very good reading. Most of the time it is electronic. Like I'll search PubMed or search the library databases to understand more about what has been done to kind of control seizure in palliative care. Is phenobarbital the only medication which is used subcutaneous apart from benzodiazepine, or someone has used something like, probably there are case reports where people have used levetiracetam. So I'll go to read through all those things. So sketch the background, critically evaluate the existing knowledge, the general situation, how the problem is developing, and is it actually worth to do the research, or is it like worthless to do? You don't need to do the research. So think about these things, read the background very well, specifically identify the gaps that you want to fill, like what is the question you're asking, what do you want to do, explain why it's a good idea about what you want to do in this research project, and be concise about the importance of your research. Also, we call it the rationale of the research thing. So the significance of the research, concise, clear, emphasize on your novelty or innovation you want to do in this research, convey the significance of your research in terms of scientific contribution, in terms of improving the healthcare, impact in medicine, if it has potential to change health policies, like it's a very simple research and the medication is very cheap probably and can be used in many healthcare systems. So probably it's a good research. And overall, if people can use it at home, and probably it will bring a change in how we manage patients. They don't have to rush to the emergency. So that will be a good kind of research if you want to do it. So try to think of on those lines if your research is significant. So now we talk about the next section is the study objective. So here we have to mention, be concise, like few lines. Realistically, what do you want to achieve? I'm just giving a simple example that I want to see if my medication that I'm using is able to control seizure in patients who are in palliative care. Do not do what I was telling before, avoid grandiose designs, like don't probably do a randomized control trial. Like I always give my example, in my thesis, I just did a simple observational study because we all have to do as junior residents 100 other things, like see patients, do home care, do calls, blah, blah, and blah. So probably simple study design is good for junior resident. When you become a staff, you can probably do complicated research studies. Also be clear about your objectives. So the next section, so we discussed our introduction, the objective. The next section is the hypothesis. So have a clear hypothesis. State the hypothesis in bullet points if possible, because then the evaluator knows that you are clear in your mind And please avoid narratives. No one has time to read the whole paragraph. Be concise, which is the most important thing when you write a research protocol and also a paper. So in my hypothetical example, my medication should be able to control seizure in patients who are in palliative care and not taking medication via oral or IV route. So next comes the aims of my study. So list your aims one by one. Again, concisely in separate lines, bullet points. 2 to 4 aims are the best. That's what literature says. If you have 10 aims, then probably you are a bit all over the place. We have to be focused in our research. So just try to make it like 2 to 4 aims. Be specific, no general or ambiguous statement like I want to see if this medication controls a seizure in 100% patient. Not going to happen. So be specific and realistic. So aims should be logically linked and arranged accordingly, testing your hypothesis. So try to maintain the order in the aims so that it's clear that you are thinking in a proper way. So the key points of your proposal is, again, the question, and question. What's your question? That's your hypothesis. Why are you doing this? The significance, and how are you going to do it? That is the research design, the way you want to go ahead with the research. So you have already established a title, a background reading of whatever you want to do. You have been able to state your aims. This is something you want to achieve in this 1 year or next 1.5 years of time. Then the thing is, how are you going to do that? So the study design is the place in the protocol where you describe the way you want to do the research. So a study design is the researcher's overall plan to obtain the answer. It is very specific, like every researcher has a different research question. So you will have your own study design. It can be observational, can be intervention, can be randomized controlled trial, can be a qualitative study, can be anything, basically. But it is very important because it tells us the strategies, like how are you going to do it, and the methods that you are going to apply to collect the data and also to do data analysis. So there is a small statistical section. If you do quantitative studies, that kind of says this is the basic format, the way you are going to analyze the data. If you write this section in a nice way, it will help you write the paper. Basically, a lot of these things are going to contribute to your methods section of the paper. So it's very important to have a good study design. So a little bit about the various studies that people generally do, like you see people doing cross-sectional survey, determine frequency, burden of disease. Some investigators do cohort study where we find incidence. Again, identify risk factors. You can do a cohort study, case control study. So risk factors for any kind of condition that you see in palliative care. For example, risk factors for developing neuropathic pain after chemotherapy can be a cohort study or a case control study. Then cohort study to determine the prognosis of a disease is difficult, but probably you will try to do a cohort study, like select a group of patients and follow them up over a period of time. Determine the efficacy, effectiveness of a new treatment. I mean, my hypothetical example is probably best answered for clinical trial or community intervention. Once we did a small trial in a community called Nurse-Led Home Care Project. It was a community intervention, but it was good. Like we wanted to see if nurse-led home care project can do the same or actually better, if not equal, stuff that we do in a doctor-led home care project. So the next thing is to evaluate community programs, and these are also known as evaluation kind of studies. So not very commonly done, but definitely you will find literature done. Okay, so in a feasibility about the study subjects, we will talk about the study subjects. So now what we have done is that we have a research protocol half finished. I have written about the design. Now, what about the study subject, like the people on who we are going to do the research on? So we all break our head on the estimated sample size. So it involves a bit of running to the statistician, running to your guide about how many patients should we actually include in the study to answer your research question. So there is no single answer to that. We'll come to that, but we'll not definitely discuss in details because it's a topic of a separate lecture. So rather important is to who is the study subject. So case definition is important. If I say palliative care patient, who is a palliative care patient? In different institutions, it can be different. Like in a institution, you can see patients who have advanced cancer who come for palliative care. In a different institution, you might see patients who have metastatic cancer coming for early palliative care. So you have to be very specific about your case definition. Are you considering patients who have advanced cancer, no cancer-directed therapy, or are you considering patients who are on active cancer-directed therapy, but at the same time are receiving palliative care? So you have to be very clear about it. Selection criteria, it will be inclusion, exclusion, like in the typical setting, I'll probably say people who can read and write. My questionnaires, if I want to use some questionnaire, more than 18 years of age, and etc., etc. Exclusion probably will be patient who will not be able to comprehend my questionnaire that I'm going to use, etc. I mean, it will definitely vary with your study. I'm just giving a rough example for the purpose of this lecture. So how about the sample? How are you sampling? Are you taking consecutive patients over 6 months period when they come to your department? Are you taking alternate patients when they come to your department? You are randomizing the patients. How are you going to do that? So write about it. What have you thought about it? And the time span for meeting the sample size. Suppose I want to do a study where I need 1,000 patients. So, I mean, then it is very difficult to probably complete the study in a 1 year time. If I want to do a study and I want only 50, 60 patients, so seems to be okay, can be probably done in 6 or 8 months time. So time span is important, be realistic, and try to answer the research question, which is a realistic question for you in your particular setting. So sample size is a big thing. So can we meet the sample size? So some things are like estimated sample size. In a protocol, probably I will write about the estimated sample size, because I never know when I do the study, I might not be able to achieve the sample size. So I'll probably write my estimated sample size is say 60 to 70 patients or 70 patients, whole number, for example. So it depends on your research hypothesis, depends on your outcome variable. If you want to say, like, I want to see that 80% of my patients are not developing seizure when I give them this medication, I'll do the calculation likewise, like based on my outcome variable. It will vary based on your research question. So there is no golden rule for a sample size. Depends on your question, depends on how that question has been dealt before in literature. All these things will determine your sample size. Also depends on what you can achieve in your institution. Also think about the estimated subjects likely to be available, because say 40% are likely to refuse. So when I say I will recruit 100 patients for my research, and I know 40% are not going to kind of consent to me, then I'll say, okay, I will approach 150 patients, and I think that I'll be able to gather 100 patients for the research. So think about it. Think about the loss to follow up at the very beginning of your research protocol. Just gives an idea that you have thought about this, you have done a good background reading about how research has been in this particular condition. So it's important to actually think about the loss in sample size when you write about the estimated sample size. The next thing is that study population, method of recruitment. So as I told you before, clearly, what are the subjects that you want to study? It can be particular type of cancer, say head and neck cancer, lung cancer, think about it. How will they be identified? How are you going to recruit the subject? Are you going to give posters? Are you going to put some banners outside the hospital? How are you going to actually get the subject? Put some advertisement in newspaper? I don't know. Inclusion, exclusion criteria. Describe each step involved in recruitment of study subject. For example, subject comes to your outpatient, your institution, you're going to meet them up. This person is going to administer the study consent form. This is the person who will describe the consent form so that they understand. You give them some time to go through the consent form, understand the research, and then they'll come back to you and say, okay, we are going to be a part of your research versus we are not going to be a part of your research. So describe the role of research personnel in this process. Like, you're not going to do the whole thing, and you need the help of your colleagues and other research personnel. So describe the role of each person there. Like office staff, they play a big role in research, in giving you the patient. So I'm always grateful to the office staff, because they are probably the main people, and the nurses who first see the patients. We get our patient only because they are kind to us. So very important to describe the role of each person who are in the institution or in the department. Mention informed consent is very, very important. So we spoke about the variable list. So variable basically is the data, kind of data that I'm thinking of collecting. So demographic data, age, gender, probably address, if necessary, contact details, etc. etc. Clinical data like their labs, can be the stage of cancer, can be the stage of any kind of disease, sites of metastasis in cancer, etc., and lab data in detail. So method of data collection, explain how you are going to collect the data. Like in what units are you going to collect the data? That is important because I mean, sometimes the units are different and it can give rise to a big amount of confusion. So also it's important when you collect the data is data quality control. Like, I mean, you don't have time to gather data from 60 patients. You gather data religiously for 50 patients and then you know how the data looks like. So because you don't have time, you thought, okay, let's just fill up the Excel sheet for the data, the remaining 10 patients, just like that. That is not good. You should be able to maintain good quality control. If you are collecting the data, be truthful. If someone else is collecting the data, keep a tab. If the data that you are getting is really the data that you are supposed to get. So data quality is very, very important. There will be missing data, no doubt, but don't, I mean, go crazy over that. Missing data is a known thing in research. So you can deal with missing data later, but collect a good quality, truthful amount of data. So, we'll go forward. So data collection tools. So explain why a particular tool is being used to collect data. For example, you want to use a survey questionnaire to understand the reliability, validity of any kind of instrument. For example, say cancer dyspnea scale. So be very clear why you're using the scale, or you're using ESAS, very commonly used, like pain scale, 1 to 10, a Likert scale. Why are you using it? Be very clear about it. Like easy to use, doesn't take much time, easy for the patient to understand, etc. Sometimes, if you want to use a tool which is not well tested before in our population, we do a pre-test in a small sample of patients just to understand if it is the right tool to use in the population. So before doing the research, you might have to do a pre-test of your questionnaire. So you have to mention that in your research protocol when you put that to the committee. Otherwise, they will ask, why are you using the tool when the tool has never been used? And also this tool is in English. This tool is not in Hindi or any other language like Marathi, any other language. How are you going to use the tool? People will not understand. So be very careful what you are trying to put in your research protocol. And you should be able to answer these questions. The next thing is analyzing the data. So you have done your research very well. You have the data with you. So the next section in the research protocol, how to do that. Again, it's a basic plan, how to analyze the data. So talk about the various statistical tests based on the type of data. If quantitative, if qualitative, then write about the way you want to do the data analysis using what kind of software. For example, NVivo is very commonly used for qualitative data, or you can also do it manually, but be very specific about it. So we're talking about quantitative here mostly. So this is the name of the variable that will be used. For example, I will use demographic variable, clinical variable, some lab parameters. Sometimes you might want to also use your the length of survival in many cancer research. State the name of the statistical analysis that will be used. For example, simple things like chi-square test, Wilcoxon's sign rank test, etc., etc. for parametric data, non-parametric data, etc., etc. Then some kind of regression analysis if you want to use, etc. So perform to assess the outcome. So also these should actually match with your outcome. Like I go back to my hypothetical example, I want to see if my medication is good enough to control seizures. So I'll base my statistical analysis based on that outcome. If qualitative, then talk about the various theories you might use for data analysis, like grounded theory, item, and other theories, etc. So the next thing is references. Use a reference manager. You can use Mendeley, you can use EndNote, as I told you before. List of references should be at the end of the proposal. The references mostly are in the background, the literature review, small literature review section. It gives an idea that this person has read the literature, whatever is known about the research. And that's why this research is something you're trying to find which is not there in the literature, in the common published knowledge. So there's the name of the authors, title of the publication, the journal year, volume, page number, when you do the references. So it's easy because the software do it for you, so you don't have to be kind of breaking your head on this. So, why is important to write a proposal? You can just write a page of your research proposal and say, okay, let's try doing the research. So why are we spending so much time, say a month, just to write a research proposal? Why? Because a research proposal will help you to do the research. It will allow you to review and critically evaluate the published literature, which is very important. We do the research and then you see someone else has done it. So there is no point in doing the research. So very important to know whether this research is important. Someone has done it. This is the first time you're doing it. Also, when you read, new ideas will come to your mind. Actually, your idea will get modified. You have novel ideas when you write or when you read about the literature. And now you question yourself and also question others if the research is worth doing. Question your peers, question your teachers, question your guide, question everyone if the research is worth doing. Also question the patient. It's called patient involvement in research. Do you think I should do this research? Just ask them. If they say okay, then probably this is something which you should do. And keep yourself focused on the research work. If there is a protocol, it's a plan, like a blueprint. So you know what are you going to do, what next. So keep yourself focused on the research, follow the timeline. It's good to be able to finish the research on time and also good for your thesis if you are doing a thesis. So basically the next things are cartoons. So first of all, get in the mood to do research. Writing the first draft. This is not easy because it takes time, as obvious. Revise. It can happen that the first draft got revised a lot. Happens to everyone, so don't worry about that. The final product should be worth doing. That's the main thing. So keep on revising, and finally you will finish after say a month or 2 months time. Then please save multiple copies of your draft. Generally, I save my copies in my email or also in cloud folder. Otherwise, sometimes you all know there are power issues, there are computer, they hang sometimes, and you have nicely typed a Word document. Everything is gone in 1 second. So please save your research, the draft. Please save it to avoid doing the same thing again and again. It happens surprising to a lot of us. So in conclusion, developing a research protocol is a time-consuming process, but it is worth it. The time-consuming process is good. It actually saves time later on. It is important to understand the steps in developing a research protocol in order to perform an appropriate study and obtain a good, reliable result. That's why we spend all the time this morning for you. So this is a slide like, so sometimes, when you write the protocol, you can register the protocol. So if you want to do a systematic review and you have a systematic review protocol, if it's a kind of review protocol, like a scoping review, you can register in Open Science Framework in the OSF. Systematic reviews can also be registered if you are doing for Cochrane in the Cochrane database. A Campbell collaboration is a place where you can register the protocol. Prospero, many of us know, is another place where you can register a systematic review. Prospero actually gives you an idea if such a systematic review has been done before. It's also a search engine there. Doing a clinical trial protocol, like observational study, try registering in the CTRI, Clinical Trials Register of India. Please register there. You'll get a CTRI number. You can mention that in your research protocol when you register a protocol. For international trials, people do register in US-based service like clinicaltrials.gov. Luckily for us, someone has done the groundwork. It's called the Creator Checklist. So based on your research type, you can actually go through this checklist to understand if you have missed out on any points. So there are various checklists for CONCERT, for randomized trial, STROBE for observational studies, quality improvement studies. Many people do these days, QI studies, SQUARE, and then there are other things like qualitative research, SRQR. So you can actually read through the guidelines. What are the points you should mention in your protocol? And then you will probably not miss out on anything, which is great for you doing it. So please try to take a look at the checklist based on the type of your research. Some people want to publish their research protocol. For those guys, we have the MC palliative care. It is open access, so you have to pay the APCs. And there is research methods in palliative care. So you might want to publish your research protocol, not the actual study. So you can go ahead and do that. So that was all in short about how to write a research protocol. Hopefully the morning was productive for you guys. So thank you very much for your kindness and listening to me. And my email ID if you got any question for me, and feel free to shoot WhatsApp message, no problem. Thank you very much.
Thank you. Thank you, Arun. Anyone wants to ask anything? Your experience of writing protocol, where do you find that you must have come across with any difficulties? You can ask right now. Any residents? No question?
Hi, ma'am. Good morning.
Yes,
I have
Dr. Raju. Yes, go ahead.
Hi, ma'am. Just have a small comment.
Do your introduction for Arun, because I think Arun is not doing you.
Hi, Dr. Arun. I'm Dr. Raju. I'm a faculty here in preventive oncology at National Cancer Institute, AIMS. So very nice presentation. I think you have beautifully summarized the entire contents of the protocol. Very excellent. So nothing about the protocol, just a comment for the participants. So protocol is a part of the grant proposal. So grant writing is different. So I think this is not the topic, but just the entire protocol goes along with the grant proposal. And in the grant proposal, the other components of the grant proposal are also, you have to be ready with your personal statement. So that is a very nice, like a personal statement shows your capabilities to conduct the project. So that is the other part. The other is the institutional support. So how your institution can support your research and conduct the research. So there are other parts of the grant proposal also. So just a comment on that one. So the protocol is just one part of the grant proposal when you submit for those things. But very well summarized, Dr. Arun, and good luck with your program.
Thank you very much.
So Arun, there is one question.
Yeah, welcome question, Anshula Awasti. So no statistician with us, from where should we study biostatistics? So when I came across the same problem, there is something called edX. It's a free course over internet. You can see there are many edX courses. I mean, I'm just telling you what I did. I can't really say what you should do. What I did is that I went to edX. It's a free course. So I spent some time in going through the modules. The faculty is very good and the courses are good. They teach you about observational studies, experimental studies, and then I also read few basic statistical books. And then actually I started loving statistics. So most of these studies that we do now, I do the statistics portion myself. So you can start with edX, and then they will suggest a lot of books. You can read through those books if possible within your small time. So try that.
Okay, then. Anything else? If there are no comments, then I just want to tell you that next lecture is going to be in the evening. So this is by Dr. Fiona. Dr. Fiona is from UK, and we cannot ask the UK faculty to get up early in the morning at 3 o'clock and take a lecture for us. So that's why, and very important topic, qualitative and quantitative research. I request everyone to join that topic, because it is always a pleasure to listen Fiona. Plus, it is also important to learn how to differentiate qualitative and quantitative research, plus how to conduct qualitative and quantitative research. And no one can be better than Fiona. So I request everyone to join next week, some Monday in the evening. Though don't wait in the morning, please join in the evening. Second important thing which I want to say is we are organizing Patient Safety Week on 17th of September, that is this Saturday. So this is very important that this is a World Patient Safety Day. And you know, there are so many good speakers. I can see that Archana will send you this brochure of this. Please join. Again, it is free of cost, 5 to 6:30 p.m. in the evening, 17th of September, that is Saturday. So please don't miss. This is also a very, very important topic, and you will listen to this stalwart that how exactly our responsibilities are as far as patient safety in terms of palliative care is concerned. Okay, so don't miss these two lectures next week. Saturday is 5 to 6:30, and next week Monday 5:30 to 6:30. 6:30 to time will be, I think, 6:30 to 7:30, but Archana will send it to you. Okay, thank you very much, Arun. I know that you must be now about to sleep. It must be very late for you, but it is thank you very much. They are your own students, and you have taught them well, and it was a wonderful presentation, Arun, as usual. Thanks a lot. Thank you, everyone. We will see you next week, Monday.
Thank you very much. Have a good day, everyone.